My name is Marilyn Powell, and I'm the Clinical Director and Deputy Scientific Director of the National Institute of Mental Health.
I'm Dr. John Sarch. I'm currently the Chief of Child and Adolescent Psychiatry at Tufts Medical Center.
Dr. Peter Cohen. I am a retired child and adolescent psychiatrist.
Sandra DeYoung.
I'm Jerry Fox.
So I identify myself as Karen, and I'm penultimate a child and adolescent psychiatrist.
I'm Marty Drell, is what people mostly call me.
Tom Anders. I'm now a retired child psychiatrist.
Almost 100% retired.
And until recently, I was in private practice in child psychiatry in suburban Montgomery County.
I am currently the president of ACAP.
And he said, why don't you consider being president? I ran for it and I got elected for it.
I served as president with great distinction.
I am also a past president of ACAP, serving from 2001 to 2003.
I found myself as a president way too early, and I did a good job, but I didn't do a great job.
I've been in these positions for the past 16 years.
I have been a child psychiatrist for 35 years.
I've been a wife for 37 years. I'm a mother of 3 grown daughters and a grandmother of 3.
The idea of legacy is very important to an old man.
We're in this for the long run, and what we want to do is leave enough of a legacy that even if you are forgotten through the history and time, you made a difference in terms of inspiring someone else.
There was only a couple of things I felt pretty sure about at the time I went to medical school, and one was that I was not likely to work with children, and I was not likely to work in psychiatry. And a lot of that had to do with the fact I didn't know much about psychiatry.
There was a great deal of stigma for medical students going into psychiatry. People would say, you know, you're too smart to go into psychiatry, or you got to be crazy yourself in order to go into psychiatry.
My parents died when I was in college. And that made me realize that life is short, and you better be doing what you want to be doing, because you don't know really what's around the corner.
In Libya, I saw this psychiatrist who was very practical and very effective with the moms, and he also worked with kids. And so I decided, serendipitously, if you will, that I wouldn't go back and finish my pediatric residency, but I would start as a psychiatric resident at Columbia.
I love working with kids, and my job is always interesting.
It's the interactions with kids, their families. It's the drama. It's the stage of just meeting another person. It's improvisation backed by a certain amount of technique and foundation and knowledge.
I was really good at getting kids back in control, and I realized all I was doing was talking about their emotions, their anxiety, and pieces like that. And I left pediatrics to go into child psychiatry.
And the other piece is families don't pull any punches with you. I mean, kids tell you what's on their minds. Sometimes I don't like what they say. I wish they'd be saying, oh, I love coming here every day. I love seeing you. But at the same time, like, it's refreshing and it's honest. It's a real partnership.
You aren't working with one person, because when you free that person up, you really work with the families. And that, because of how long I've been in the field, I've been able to see over and over again. And for me, that's my joy.
I've had the good fortune to have stayed in the same geographic location for a long period of time, and I have really seen kids move through their lives.
It's a joy to work with a patient who I've seen for 10 years. I mean, you know, it's so much fun. I'm having a blast.
I'm now struggling with, what retirement will be for me. And the problem is I'm a workaholic. And in the sense that I have to be doing things all the time.
Psychiatry is similar to golf. You know, you can play golf into your 90s because it's not a very physically demanding sport. And if you have a passion for what you do, I think longevity just comes with it.
The good part of that is I get to do the stuff that I really like to do. And those are the things like teaching. I'm still writing papers.
I've gotten rid of things that I didn't like to do, and I'm back to being a consultant, a mentor, and have a small psychotherapy practice that I can do the way I want to do it, like in the old days.
Oh, I have to say, because I don't feel like my career and my practice has ended. I don't see patients, but my career hasn't ended because I'm still working on this project with ACAP, and I'm here talking to you. So I think it's just sticking with the things that you enjoy, and along the way, making room, that your career doesn't push out everything else. If your career has pushed out everything else, then you very well may want to end at some point to try those other things.
It isn't a 9-to-5 job. It's something that you commit yourself to. And when you do that, I think it takes on its own gratification, particularly when working with others.
As we get older, we become the elders of the tribe. And it's almost an obligation to stay around to pass that on to the next generations of child psychiatrists.
It's really important that there's certain kind of lessons you can hand on, a certain amount of just presence you can hand on to the next generation. So there you go.
I'm trying to figure out the right balance, and I'm still teaching. I'm still curious. I'm still pretty much, if you ask me to do something and it's not onerous, I'll help you out with it.
My father would be up at 4 o'clock every morning exercising. Daddy always said that a healthy brain needs a healthy body and exercise.
I try to carve out time for my family, my friends, and other people involved in my life. And I try to balance that. And then I have ACAP colleagues who remind me that I need to balance that.
I like to walk. I like to cook. I like to sleep. I like to read books.
I'm a huge believer in adult play, and I do all kinds of things. I mean, I love to garden, I love to swim, I love to hike.
I tried to keep my personal life and family life separate.
I know what's important to me, and my family was really important to me. It is really important to me.
I loved being overseas. I loved being in a different culture. I would have spent much more time overseas, but didn't because of having patients here and having my children need to have a home base.
As a family person, I feel that's a very strong identity. And now in retirement, it's even better. I mean, I have a lot more time with my kids and enjoying my grandchildren.
And I think very, very, very important, remain socially connected. It's one of the reasons I don't like moving around. Like, I could have taken jobs, opportunities in different parts of the country, but I like being anchored.
Loving relationships keep one well, and they are so important to sustain over time and not to neglect.
My concern about wellness is that it implies that surviving in the profession is your individual personal responsibility, when I think the things that are actually creating the pain and suffering that we're trying to heal by wellness is caused by the system, and we need to change the system. And so my approach is to talk about it, to not be intimidated, to talk about the fact that we're overworked and understaffed, and to push back a little on the idea that you individually will solve your wellness problem.
I was lucky enough as an M1 to walk into this classroom, which I now teach in with 300 students, and listen to Jay Hirsch give a lecture on child psychiatry and working with families and systems. And I fell in love And I went down at the end of that lecture and I said, "Would you be my mentor?" And he said, "Of course, honey." And from that moment on until the day he died, he taught me everything.
It won't come on its own. You have to be active in pursuing your mentor. So if you find someone that you seem to resonate with and they have a set of interests that are similar to yours, you have to pursue them.
Sometimes people can tell you all the pragmatics of what you need to do to get to the next step. But sometimes what you really need is someone who understands the experiences that you're having, because they contribute so much to the actual challenges that you're experiencing.
But I found within ACAP, the people were incredibly generous of their time and interest if you had a question about anything.
ACAP, I think, does such a nice job of providing mentorship experiences, for example, at the annual meeting.
It is amazing to me what relationships I have built over all these years through just meeting at ACAP, reconnecting, and very special.
Join ACAP, and if you are a medical student, get your program to send you every year.
It was also mentors along the way who really believed in me.
The timing of the mentorship was very important. If I hadn't had it at certain points in my career, like when I wrote my first grant in IMH and was rejected, I would have given up if it hadn't been for a mentor who said, "No, this is a tough world. You got to take that grant and take that criticism and rewrite."
Sometimes it doesn't work out and you have to look for a second person, but you have to find one.
It's not all straight up moves like a ladder. There are a lot of lateral moves, like a jungle gym. You learn something in every lateral move you make. That's still all getting you to where you're going to go in your journey.
The great part about child psychiatry is we can write our ticket. You have an opportunity to be an explorer in a new world, and it's always a new world that's constantly being created.
It's a wonderful place to be. When you can make a sad child feel better, it just feels so good.
I never go to bed at night thinking, am I doing anything with my work life?
The opportunity for actual change in people's lives is in front of you.
As a medical student, not exactly knowing where I was going to end up, I ended up in the right place.